Welcome to this explainer. If you're joining me today, chances are you already know the feeling. You look at the backs of your legs and you see those blue-purple ropes kind of pushing against the skin of your calves. And by the end of a long day, well, there's that familiar heavy ache that just doesn't seem to go away, even when you finally sit down. Now, for years, you might have been told, hey, it's just genetics, or maybe that it's simply the price you pay for standing on your feet all day. But today, we are going way beyond the surface. We're going to uncover the mechanical truth about varicose veins, and more importantly, a completely free, non-invasive protocol to help you fight back. Okay, let's dive into this with a quote from Dr. Laura that honestly just flips everything we thought we knew completely upside down. She says, "The wall is not where this starts. The wall is where it ends up." Now think about that for a second. This is a massive paradigm shift. It shifts the blame entirely away from the visible bulging vein wall and points directly to the real hidden culprit inside your leg. It basically means that if you're just treating the wall, you're only treating the effect. You're totally missing the cause. So that brings us to section 1, the vein wall myth. There is just a really stark contrast between how modern medicine usually looks at this and what the actual mechanical reality is. The standard medical approach, well, it looks at a varicose vein, sees a stretched out, ballooning wall, and assumes the wall itself is the problem. Fix the wall, fix the vein, right? That's exactly why the conversation instantly jumps to things like closing it, stripping it out, or injecting chemicals. But fluid physics tells us a totally different story. The reality here is that the root cause is actually fatigued valves inside the vein. They are crying out for mechanical pressure relief, not just a surface-level fix. Now, don't get me wrong, I'm not saying surgery is never appropriate. For large, severely symptomatic veins, those procedures absolutely have a legitimate place. However, for early to moderate varicose veins, surgical procedures like sclerotherapy or ablation almost guarantee the issue is going to return over time. Why? Because they completely ignore that mechanical origin. If you don't actually address why the blood is pooling in the first place, the problem is just going to pop up again in another vein. Moving right along to section 2, the trapdoor mechanism. So inside your veins, particularly down in your legs, you have these things called venous valves. These are tiny little folds of tissue, literally no larger than your fingernail. Just think about this for a moment. Your legs spend the entire day fighting gravity, right? And they rely entirely on these microscopic little structures. Their one and only job is to open up, let the blood flow upward toward your heart, and then immediately snap shut so that blood doesn't just slide right back down into your calves and ankles. Dr. Laura uses this brilliant metaphor to explain it. Imagine a staircase, but the steps are actually trapdoors. Step 1, the blood climbs up a step in the vein. Step 2, that trapdoor snaps completely shut behind it, locking it in. But here's where we hit step 3. What happens if those trapdoors start to stick? What if the hinges get a little stiff and the flaps only close halfway? Well, the blood slides right back down, and it pools with the blood that's already waiting below it. This creates step 4, which is a massive rise in pressure. And because your vein wall is living tissue, it's not some rigid metal pipe, that sustained pressure literally causes it to expand. And that expansion, my friends, is a varicose vein. Let's look at section 3, what weakens your valves. So, what's actually causing this? There are 3 primary threats to those tiny trapdoors. First up is sustained gravitational load. Standing or sitting for hours on end just creates this uninterrupted column of blood pressing down hard on those valves. Second is connective tissue weakening. And I really want to speak directly to the silver sages in our audience right now. After age 40 and accelerating pretty rapidly past 60, your body's natural collagen synthesis slows down. Since your valves are made of collagen, they're quite literally losing their raw building materials. They become thinner and less resilient over time. And the third threat? Chronic abdominal pressure. Anything from a chronic cough to constipation sends these downward pulses of elevated pressure, which basically teaches those valves to just stay slightly open over time. But on top of that, there are these unseen accelerators, especially for folks over 60. Take sitting with your legs tightly crossed. That actually compresses the popliteal vein right behind your knee, acting almost like a partial roadblock for your blood. Or how about prolonged hot baths or showers in the evening? The heat causes your veins to dilate, which makes it physically harder for those little valves to stretch across and close properly. And finally, a low intake of dietary flavonoids. This is a slow, practically invisible deficiency that just quietly weakens your vein structures. Just to prove how incredibly impactful these mechanical factors are, let's talk about Margaret. Margaret is a 64-year-old library worker. She was on her feet all day, and she was literally holding a surgical quote for laser ablation in her hand. But her doctor discovered she was suffering from chronic constipation, which, remember, means chronic abdominal straining. By simply treating her constipation, thereby relieving that downward pressure, and starting a daily mechanical protocol, Margaret's symptoms improved so dramatically in just 8 weeks that she actually canceled her surgery. No way, right? But it's true. Okay, moving to section 4, foods to rebuild valves. For the nutritional side of things, Dr. Laura points to 3 highly accessible pillars. And we are not talking about crazy expensive pharmaceuticals here. We're talking about whole cooked buckwheat, the white pith of citrus fruits, and tart cherries, whether you use them frozen or in concentrate form. So why these specific foods? Well, it's because they are absolutely packed with dietary flavonoids. We're talking about compounds like rutin, hesperidin, diasmin, and anthocyanins. These are incredibly powerful plant compounds that directly support the tissue integrity of both your vein walls and your valves. Remember just a minute ago when we talked about that invisible drop in collagen that really hits the silver stages past age 60? These compounds are the essential raw building blocks your body is desperately begging for to slow down that decline and keep its structural strength. So the absolute key here is getting enough of this stuff into your daily routine. Take a 1,000-gram portion of whole cooked buckwheat, for example. That contains massive levels of rutin. And to be clear, we're talking about actual whole cooked buckwheat here, not just a little buckwheat flour baked into some bread. Eating this grain just 2 to 3 times a week actively strengthens that collagen matrix in your vein walls. In fact, clinical trials have shown it significantly reduces leg heaviness and swelling. And the best part? It actually works better than some super expensive supplement, and it costs less than a bag of rice. And listen, whatever you do, please, please do not discard the citrus pith. You know when you peel an orange and you pull off all that white spongy stuff and throw it in the trash? You are literally throwing away diasmin. That is the exact active compound they use in actual prescription venous medications all across Europe. So eating the whole segment, pith and all, naturally builds up your body's pool of this compound. Pair that with 2 tablespoons of tart cherry concentrate mixed into your evening glass of water, which delivers those inflammation-reducing anthocyanins, and you are actively rebuilding those valves from the inside out. Now for section 5, the daily mechanical protocol. All right, here's exactly how you maintain your legs during the day. Step 1. Every single morning before you even have your coffee, do 30 rapid, firm, barefoot heel drops on a hard floor. Just raise up on your toes and drop your heels down firmly. This forcefully activates your soleus muscle, which is your deep calf pump, and it gives gravity some serious competition right as you kick off your day. Step 2 is what we call the desk roll. If you are sitting down for 30 consecutive minutes, you have to pause and do 10 ankle circles and 10 slow calf raises. Now, this isn't a workout. You're not trying to break a sweat. You're just keeping that muscle pump running so the blood doesn't pull down against your valves. But the absolute most crucial part of this routine happens at night. The evening protocol requires you to elevate your legs at a 45-degree angle, making absolutely sure your heels are higher than your heart for about 15 to 20 minutes. You want to do this roughly an hour before bed. And what you're doing here is deliberately reversing that gravitational load. You are physically draining the fluid reservoir that has been pulling in your calves all day long, pulling it back towards your body center and circulating it through your kidneys while you are still awake. And that right there is exactly why you always want to follow this up with a bathroom visit. You definitely want to prevent your body from trying to process and drain all that extra fluid at 2 in the morning. So let's break down your immediate action plan for tonight. The very moment you take your shoes off, knock out 30 heel drops. Then at dinner, try to reduce any hidden sodium from things like cured meats or heavy cheeses, because salt actively feeds vein inflammation. Before bed, get in your 15 minutes of 45-degree leg elevation. And finally, when you shower, try to finish it off with just 30 seconds of cool water directly on your legs. I know, it's a little chilly, but that cold water physically tightens the vein wall and passively forces those little trapdoor leaflets closer together. Now, we have to talk about the timeline because this brilliantly illustrates the reality of human biology. Venous valves rebuild slowly. You really have to look at this as daily maintenance for a structural system that is literally fighting against the physics of gravity every single day. So this isn't some overnight magic quick fix. You need to commit to this combined mechanical and nutritional protocol for a full 3 months before you start evaluating the results. Remember, your veins are not just some cosmetic flaw waiting for a surgeon to cut them out. They are a vital, living structural system, and they are actively calling out for your support. Which really just leaves us with one very simple question to think about. Your valves have fought a brutal, exhausting battle against gravity all day long, carrying the full weight of your blood step by step. Will you give them just 15 minutes of rest tonight? Take control of the mechanics, give your body the structural, nutritional support it's begging for, and start reversing that pressure today. Thanks so much for joining me on this explainer, and I'll see you next time.